You know what's on my mind today? The coronavirus. Here on my daily thought bubble. So over the last few days, I've been preoccupied with the thought of the coronavirus spreading in the Philippines and in Metro Manila because I don't think our government is fully prepared for this epidemic. Now, I have noticed that there haven't been a lot of testings being done. Correct me if I'm wrong, but I don't know of anyone being tested. So how do we know if this is spreading or not? And recently, there have been 2 cases of coronavirus that have just been announced over the last 24 hours, very close to where I live and where I normally go. And that's absolutely freaking me out right now. So it is freaking me out so much that the other day I had several meetings and I must have shaken hands with about 15 people. And every time I shook their hand, I was worried because they were just reaching out to me. And I wanted to say no, but I didn't want to be rude. And I didn't know how to say no. So I just shook their hand and then I realized, my God, what am I doing? After the meeting, I actually ran to the washroom and I washed my hands immediately with a lot of soap for over 20 seconds. So what can we do about this coronavirus and what is really going on? So what I can tell you is this. I think that the government is not fully prepared. The Department of Health has limited amount of testing facilities in the entire Philippines. If I'm not mistaken, there are only 4 in the entire Philippines. And not only that, I don't think they've done enough tests to determine that there are literally only less than 10 people infected with the coronavirus in the Philippines, a country with over 100 million people. I don't know about that. I'd be very scared to find out that those numbers are wrong, and I have a strange feeling that those numbers are wrong and that there could be hundreds already, if not thousands, infected with the coronavirus. So, just to be cautious, and like my friend put it, he said to be conscious, is that be aware of your situation and how you conduct yourself. So right now, the things that you should do in light of this epidemic is, number 1, wash your hands frequently. And apparently you have to wash it for at least 20 seconds with soap and water. Number 2, wear one of these. So I got myself these. All right. And the reason for that is so that if anyone coughs and suddenly water droplets drop on your face, it doesn't go into your mouth or your nose. And that's the important thing. The other thing you could do is don't be touching your face. Now, I have a bad habit of touching my face, and I have to be very conscious not to do that. For public places, my recommendation is when you see people now, don't reach out and shake their hand. Instead, maybe just smile and nod your head, or do what the Japanese do and just go. Or, if you really have to make contact, an elbow bump or a fist bump at the very least. That's what you can do to prevent the spread of this disease. And starting now, I'm not going to be shaking people's hands. And even if they want to shake my hands, I'll tell them no. I'll actually just say no, and I'll put my fist out and I'll just do a fist bump, or just nod at them and just do this. So I hope that the malls don't let the security guards touch us anymore to frisk us, because that could be dangerous because they're frisking a lot of people. And if they frisk a person that's infected with the coronavirus, and then they frisk other people, that could lead to an infection. Again, these are just safety precautions that I think. I'm just a little bit more paranoid than others. I don't know. Now, the other thing we could do is when we're in enclosed spaces like elevators, wear a mask and make sure you cover your mouth. When you're in public transit, like a bus or a jeep or anywhere that there's a lot of people, might be a good idea to wear a mask just to be safe. And avoiding physical contact is probably a good thing. So does that mean as well that people should be abstaining from casual sex? Maybe they should be. And going out in big events where there's a lot of people, that could be fairly dangerous. Now, for the people that are watching this that maybe feel a little bit sick, maybe you're under the weather, please have yourself checked. Especially if you're in the service industry where you're dealing with a lot of people, because you shouldn't just be thinking about your own health. You should be thinking about all the others around you and how you could be infecting other people. Just to play it safe and just to rule out any possibilities, go to the doctor and have yourself checked if you're feeling a little bit under the weather. And I hope that this epidemic can be managed in the next couple of months and those that are infected fully recover soon. This is Christian, and I'm hoping for everyone's good health. And that's my daily thought bubble. See you on the next episode.